Welcome to SonoSim's DMS webinar series. On this webinar, our team of expert sonographers will discuss making the ultrasound learning experience pertinent to careers in the real world. All attendees are in listen-only mode, but you may ask our panelists questions at any time through the webinar chat. A recorded version of this webinar will be available after our session. If you're just joining us, welcome. At this point, I'll introduce Tracy, SonoSim's DMS Program Advisor. She will discuss how scanning practice with real patient pathologies fits into a successful ultrasound education program. We will then hear from Melissa Kang, one of SonoSim's ultrasound education and production managers, about challenge cases and other new DMS content. Finally, Member Success Manager Courtney Reising will touch on how we can best support you in integrating SonoSim into your curriculum. Welcome, Deb.
Thank you, Heidi. Hello, everyone. I'm Deb Tracy, SonoSim's DMS Program Advisor. I've been a registered sonographer since 1979, and my career includes being a clinical sonographer and DMS clinical instructor, as well as working on the commercial side of ultrasound. Sonography is an important diagnostic tool that plays a significant role in delivering quality patient care. It is critical for a sonographer to provide the interpreting physician with a complete and comprehensive ultrasound exam. The goal of a DMS educational program is to prepare sonographers with a well-rounded program that includes training in both routine ultrasound exams as well as exams with pathologic or abnormal findings. As an instructor, you know there are many requirements and several key challenges that you are faced with in providing your students with quality training. This includes access to enough ultrasound systems as well as ample time on those systems for the learners to practice. Students need teaching moments with both patients that have normal anatomy as well as patients with unusual or pathologic findings in order to build confidence for the real-world situations. After the knowledge and skills are taught, repetition in scanning is necessary to ensure mastery. To evaluate mastery, you need assessment resources to ensure your students can recognize anatomy and pathology to provide a comprehensive exam. Finally, students need additional resources to avoid skill decay and loss of critical knowledge. We've all been there. We've all been at that moment where we see something and it's like, well, what do I do now? It's that pause where all of a sudden we have to remember to go back to what we've learned, go back to the basics and follow through with image protocols. Because the goal is to identify the abnormal. We first identify the normal, so that helps us to rule out things. But when we see something different, and it's not necessarily bad, it's just different. So we really have to rely on what we've been trained to do. We prepare our students as best as we can, but there are always limitations. There's limitations in a scan lab where we rarely have patients with abnormalities. And then in the real world, when we start scanning and we see something different or abnormal, depending upon the level of the student, they may go and get their clinical instructor and say, I need help. So it creates that churn, and we have to give them pause and to relieve that situation. Their stomach flips when they say, I've never seen that before. And it just kind of gives them that pause. But we want your learners to be confident as they move into a clinical setting. And that begins with having a strong foundational knowledge and standardized protocols and how to identify image pathology. Without this resource, the student isn't fully prepared. It can be extremely daunting and perhaps even overwhelming for some to begin performing a routine exam and find something outside the norm. Having access to ultrasound exams that contain pathology or unusual findings will help to reinforce your students' knowledge and help them feel confident in their abilities and lessen that panic factor that abnormalities can often cause when they first see it. SonoSim offers various resources to help members remove these barriers from your learners' training. We offer over 75 didactic peer-reviewed courses that provide your students the experience of leading educators in their respective subspecialties and introduce foundational concepts as well as pathologic or unusual findings. Our SonoSimulator gives access to hundreds of hours of hands-on image acquisition and interpretation for a wide range of scanning scenarios, including both normal and abnormal. This additional learning reinforces the student's ability to piece together their findings and feel reassured that they performed a diagnostic exam. The images acquired by the learner in our SonoSimulator can then be assessed with SonoSim's performance tracker by the instructor. The instructor can then review and then give feedback and tell them what they did well as what needed improvement. This opportunity to further their learning experience and take the time to review with them can be priceless. For example, when I was teaching someone to scan, if I sat next to them in complete silence, they would pause from scanning like, am I doing okay? Or what's next? So I would quietly say, go ahead, you're doing good. So it's that reassuring voice and the opportunity to go back into SonoSim's performance tracker to review these cases and get that feedback from you. This is such an easy way for instructors to keep track of your learners and mentor them. When you review these images, you can see that your students identified an abnormality and took the appropriate images, giving us the confirmation that our students recognized that was something abnormal and knew to take images in various planes to provide an overview of the abnormality along with the surrounding organs. I'd see that they felt comfortable knowing what they were looking at. Now, when they see a similar case, it builds their confidence, and next time they'll think, I've seen something like this before. And it's that repetition that builds their confidence. And seeing something for the first time, it's not necessarily that you're going to be able to make a diagnosis out of it, but at least you're going to be able to take the images that will provide the physician with some answers or some clues. And now, using SonoSim's expert-driven AI technology to automate assessment of certain types of images, this saves the instructors countless hours of ultrasound image grading and is an easy way to provide learners with quick and helpful feedback. SonoSim's live scan with Case Builder allows you to create your own case scenarios and test your sonographers on their clinical knowledge and scanning skills. And this is a biggie. This allows the instructor to really assess their students and provide them with challenging training cases. You can assemble your case scenarios in a way that you interpret a scan should be done. For example, if you didn't have the opportunity to live scan due to a system going down or a model not showing up, you can utilize Case Builder to create the scanning scenarios for your students that may have otherwise been missed, giving your learners the additional opportunity to store that knowledge because, as we know, repetition is key. And then when you see something that looks different, you'll have the confidence to know what to do. So keep in mind that Case Builder will allow you to provide more opportunities for your learners and build on their clinical knowledge. We also offer ultrasound guided procedure training, which is a great resource for your students to be knowledgeable about procedures such as central line placement or musculoskeletal injections and aspirations. As sonographers, we don't actually perform the procedures, but rather assist by scanning. So your learner may all of a sudden be in a situation where the registered sonographer may be pulled away for a moment, and then radiologist says, okay, let's go and scan the area. Sometimes a sonographer will scan first to identify and mark the area of interest, or we may hold the probe in place while they advance the needle. So as sonographers, we're responsible for understanding the needle-guided procedures. Having a simulated environment to go to through all the motions of this procedure can help us better understand our role as a sonographer. This year, we put a lot of focus on expanding our DMS offerings, focusing on protocol assignments that reinforce foundational scanning techniques. But today, we want to discuss advancing learners to the next level, which is imaging pathologies. So now I'll pass it on to Melissa Kang, a SonoSim ultrasound education and production manager, for a more in-depth look at utilizing our training resources for exposing learners to pathology. Thank you. Melissa?
Thank you, Deb. Hi, my name is Melissa Kang, and I'm one of the sonographers at SonoSim. Like Deb said, it's difficult to provide adequate exposure to cases with pathology. There's just limited access. And even when the learners do get to scan those patients, they're limited to how long they actually get to scan. SonoSim provides a comprehensive platform for overcoming many of these limitations. And I want to take a moment to review all the pathology resources that are accessible to the SonoSim learners and instructor. So when you start training, you start with the foundational knowledge before you even begin to introduce pathologies. And the anatomy and physiology modules, they provide that solid introduction to each specific organ and area of interest. Here, I have opened the online course, which reviews the general anatomy, physiology, general technique, and imaging. Once you have completed the anatomy and physiology modules, you should have the foundational knowledge that you can apply towards your protocol assignments. And the protocol assignments are really going to teach and guide them through imaging protocols. It's going to walk them through and break down this very exact methodical process of training. And the end of the assignment, they'll have a comprehensive exam for clinical assessment. So the assignments will provide clear and concise instructions for standardized windows, annotation, tell them when to use colored Doppler and pulse wave Doppler. So now your learners have the normals down, which means it's time to start introducing pathologies. Let's take a look at the core clinical and advanced clinical modules in the library. These modules provide structured training for identification of common pathologies in the same modular format. The courses introduce clinical indications, and they reinforce technique and general consideration for pathology. So this is more of a step-by-step approach. The case studies are introduced like they would be presented in real life. They guide the learner through the thought process of associating patient's symptoms with the pathology. For example, like this hydronephrosis case, this patient came in with right flank pain, vomiting, and decreased urine output. He has a history of renal stones and neural nephrostomy tube placement. As a sonographer, my first thought is, does this patient have stones, hydronephrosis, cysts, or even something that's referred pain like hepatitis? It's important to take into account the symptoms and possible pathology. If I don't find anything, then I want to do a double check and make sure I did a proper assessment. We do our checks and balances. This will guide learners to understand how to use the symptoms in their imaging process and understand what type of questions to ask the patients. How many times do we ask, show me where it hurts the most, but just use one finger? And we use that question to help guide us. These are all the modules in our core clinical and advanced clinical libraries. And they all cover imaging abnormalities and pathologies. For example, in aorta IVC core clinical, they learn things like the AAA and aortic dissection. In the bladder core clinical, it introduces cystitis, bladder rupture, and visualizing Foley catheter. In the cardiology core clinical, they learn about concepts like right ventricular overload, quantifying left ventricular ejection fraction, and pericardial effusion. All of these core clinical and advanced clinical modules have pathology cases of real patients that can be scanned in the SonoSimulator. As I scan through the SonoSimulator, let's do a quick recap of their training, what their training has looked like so far. They have learned the normal anatomy and how to identify the common structures with anatomy and physiology cases. They've practiced scanning through complete protocols using DMS protocol assignments. Now they're ready to be introduced to abnormal cases. So this is what they'll find when they get here. They will already know that they are familiar with the concepts of documenting pathology. They know they need to start scanning in long and transverse. They know they need to apply color Doppler and how to appreciate flow characteristics. They know they should apply compression to either rule out or confirm there's thrombus, because these are all concepts that they have worked up to. And now they can apply everything they've learned to real patient pathology. If you combine all the categories shown here, we have over 400 cases for training in pathologies and procedural content. And for all of these, there are virtual expert assistants available for learners to use the optimal probe guides or image interpretation. This will not only increase the learning opportunities, but also learning time and value for each individual. So when you use these pathologic cases with the program curriculum, these learning moments can also be standardized across an entire class. Let's take one more step. So now we're going to be introducing challenge cases. These pathology-focused cases are unique to the SonoSim library. They are not the same cases you find in core clinical or advanced clinical modules. Challenge cases are standalone scanning cases that are nested within their respective SonoSimulator categories. So if you're looking for something like a AAA, you will look in the vascular category. The pathologies introduced in challenge cases can be some of the hardest for learners to access in a normal clinical rotation. How many times have you seen a spina bifida case in a normal hospital setting? Unless you work in a specialized OB center, the chances may be slim. Also to take note, with OB scanning, AIUM has strict guidelines for scanning times. This adds the difficulty for a learner to gain competency in scanning OB pathology. The challenge cases make these scanning opportunities much more accessible. They teach the learners the necessary subtle hand movements and hand-eye coordination to capture the needed imagery in such cases. How many times have you scanned a fetus that is perfectly positioned? The majority of the time, we see a curled up fetus, oblique fetus, or even not in any optimal position at all. For example, here are one of those cases. As sonographers, we know how to move and to manipulate the probe to get the best possible image. And we understand the imaging challenges, and we've had years learning how subtle movements can make all the difference. The more practice our learners get with scanning abnormal and difficult cases, the more instinctive the movement becomes to opening windows and obtaining all the required images. One thing I've noticed over the years is if a sonographer is nervous when coming across an abnormality, they tend to forget to take images. It prolongs the scanning time or even result in another session to get scanned in a later date. This is why practice beyond normal anatomy scanning is so critical. Going beyond just knowing protocols, we want our learners to be confident in all the required images and assisting in getting a diagnosis, regardless of the pathology presented. It's being able to say, I've seen this before and I know what to do. Using SonoSim ultrasound training solution, there are a variety of ways to integrate the precursor training, using real patient pathology and give your learners the real life challenge of working through these pathologic cases. You have the hands-on ultrasound training, didactic instruction, and assessment tools to minimize barriers and standardize integrating both pathologic and non-pathologic cases into your curricula. SonoSim is committed to providing a consistent and constant flow of useful and engaging material for our members, which is why we regularly release new scanning content. I'm going to turn it over to Courtney Reising, who is SonoSim's Member Success Manager. She will give us a brief overview of our member success services and our DMS roadmap.
Hi, thank you, Melissa, for that introduction, and thank you all for joining us today. My name is Courtney Reising, and I'm with the Member Success team here at SonoSim. As Melissa said, we are committed to continuing to release training content that will help you be successful and enrich your curricula. So far this year, we've added something new to almost every subset of training, from pre-dialysis vascular mapping to LVAD problem-focused echocardiography modules, as well as MSK injection procedure modules. We have also expanded our DMS protocol assignments with several new OB and vascular additions. Our most recent release included our resuscitative TEE module, which is a great resource for students to learn about using transesophageal echocardiography, as well as the tibiotalar joint injection and aspiration procedure module, and the DMS renal arteries and aortic iliac protocol assignments. Recent product improvements include new performance reports, automated image assessment with AI, updated image feedback and performance tracker, as well as updates to the SonoSimulator interface, case selection experience, and main menu. As you can see, we also have quite a few releases planned for the coming 9 months. We are currently developing content for abdomen and small parts, cardiothoracic, OBGYN, musculoskeletal, and vascular, as well as adding on even more product improvements. This is in addition to future challenge cases, which will involve pulmonary, cardiac, and musculoskeletal pathologies. Our mission and member success is simple: to ensure our members achieve their ultrasound education and training goals with SonoSim. We are always looking for opportunities to gather feedback and suggestions from our members. We take your requests very seriously and do our best to incorporate your suggestions into our development roadmap. We also provide key resources to support successful onboarding to SonoSim, ongoing user training, curriculum integration support, in addition to regular rollout of newly released content and features. We also support DMS programs as they leverage the protocol assignments offered through SonoSim. Our team has worked extremely hard to put together the protocols that align with AIUM practice parameters. If you're a SonoSim member in the DMS space, you will hear directly from the member success team when new protocols are available. At your convenience, we would also be happy to schedule some time to walk through the tools available now and discuss best practices for integrating them into your program. I want to thank you all again for being here and encourage you to reach out to our team anytime we can be of support. Thank you.